Shreya has asked views of Dr. Hahnemann on the management of cancer and such diseases. Okay, so Shreya, what Hahnemann has written is, first thing that you need to understand is that Hahnemann has classified cancer as SORA. When you are reading textbooks on miasms that you read in your colleges, you will find that tumors are classified in psychosis because there's growth, and if there is degeneration in any cancer, then it is considered as syphilitic. But that is all absolute farce. It's nowhere close to what Hahnemann has written, and Hahnemann has not written that anywhere. In fact, Hahnemann has not written anywhere that functional diseases are soric, diseases related to growth are psychotic, and degenerative diseases are syphilitic. Hahnemann has not written this in chronic diseases. You have to read it to find it for yourself. Most of the chronic diseases that you read in your college, they are all derived. They are work of Ortega, they are work of Kent, they are work of H.A. Roberts, Stuart Claus, but they are not the words of Hahnemann. What Hahnemann has written is that nearly all cancers are soric in origin. And when he says soric in origin, what it means is that there is, my personal take on it is, because nobody knows what Hahnemann exactly meant from SORA at that time, but I personally feel is that there was a condition where Hahnemann was able to identify a lot of diseases coming after syphilis or after gonorrhea or genital warts. The rest of the diseases he classified as SORA, and for me that SORA includes a lot of viral diseases and the hereditary conditions that a person is born with, hereditary susceptibility that the person is born with. So this is what Hahnemann has written. So if you need to treat SORA, you need an anti-soric remedy. And what is an anti-soric remedy? As an anti-soric remedy is a remedy that covers the current complaints, the past medical history of the patient, and the family tendency of the patient. If your remedy covers all that, then you can treat cancer just like any soric problem or any miasmatic problem. That is how you treat miasmatic complaints. Your current complaints are there, but you do not just focus on the current complaints. You look at the whole history of the patient right from the childhood. You even go beyond, like what tendencies this patient is bringing from his ancestors, and then you put all that together and find a remedy that has that kind of tendency along with that kind of symptoms, and that remedy is the anti-soric remedy for you. Anti-soric remedy does not mean SORA or psychosis, sorinum or sulfur. Bonegasson wrote a full repertory on the repertory of anti-soric remedies. That was one of the first repertories of homeopathy. So there are a lot of anti-soric remedies. So that is the way you have to actually treat cancer. Cancer is treatable, but it's not easy to treat. You need a lot of expertise, a lot of experience to actually manage it properly. And there are very few people who are actually doing it successfully. That is also, I'll tell you. And one of the reasons is that there are very few people who get cancer patients which are untreated, which have not had chemotherapy, which have not had radiotherapy, which are not on the last stage of cancer. Even in my own practice, the most of the cancer cases that I get, they are last stage cases. They have done the chemotherapy, they have done the radiotherapy, and now their conventional medicine has nothing to offer. Then they come to you, sir, can you do something? And then it becomes nearly impossible to do something radical for such patients. But there are a couple of people who are doing. A.U. Ramakrishna is very famous down south, and the modern master is Dr. Sunil Sarkar. He has a lot of experience with cancer cases and with beautiful results. So yes, people are doing good work, but you need a lot of experience in treating those cases. But of course, you get experience only once you start treating them.